St Helens and Knowsley NHS Trust covers a population of around 350,000 people. It works over 2 sites, Wiston and St Helens Hospitals. The first dedicated urology surgeon was appointed in 1988, and since then the unit has grown to a team of 7 consultants, 4 uro-oncology nurse specialists and 4 urology nurse practitioners. 7,717 new referrals were received between April 2015 and March 2016. Nearly 15,500 revisit patients were seen in urology clinics in 2015, and 222 new patients were diagnosed with prostate cancer in that time.
My name's John McCabe. I'm a consultant urologist here at St Helens and Knowsley NHS Trust. I've worked here for about 5 years now, and I'm the clinical lead for the Tru North project here. The Tru North project allowed us to explore different ways of following up our prostate cancer patients and exploring new, more efficient ways of offering our service to the patient. First driver of change was our increasing number of patients that we see with a diagnosis of prostate cancer, and a need to really look at the clinical model that we offer day to day in terms of, in particular, the way we follow up these patients. Patients were driving this need for change. Many patients with stable diagnosis will be coming for regular follow-ups, having regular blood tests, and really raising the question themselves, is it possible for this care to take place out of hospital, more remotely, via some form of telephone interaction perhaps? And certainly that's what led us to explore this as another way forward for the patient. Patients would often have many symptoms that they would be patiently sit with and wait until the next follow-up, which could perhaps be 6 months away. The Tru North project enables them to become better informed, for them to access information at a time that suits them, and really interact with us in a more timely manner than await the more traditional clinical setting for follow-up and information sharing. A fourth factor in adopting this programme really is that there's certainly policies and a drive out there to embrace newer technologies in the way we manage our patients, and the Tru North project certainly takes this approach by enabling the patients to utilise information technology as a portal for them to communicate with the hospital, gather information themselves, and help make important decisions about their diagnosis and their future treatment. I think this is increasingly relevant in the world today, with everybody of all ages having greater access to information technology. And despite the fact that many of our patients with an increasing ageing population are being diagnosed at a later date, they're certainly more than capable of adopting such technologies. The Tru North project has allowed us to really address all of these drivers. It's allowed us not just to address problems that we face with capacity within our current clinics and the service that we offer, but also an opportunity to enhance the service that we offer. I think one of the key drivers in cancer care in general is looking at survivorship now, is looking at how patients live with their diagnosis day to day, and certainly the level of information and the level of communication that patients are able to adopt with the Tru North project is much enhanced by this new approach.
In April 2014, our trust became involved in the Tru North project and has delivered a programme which aims to improve follow-up care.
The service allows us to, first of all, risk stratify our patients so we can establish which patients we can safely manage out of the hospital environment in this supported self-management approach. Eligible patients will be identified at clinic based on the protocols that we have established. Once they've been enrolled onto the IT portal, they'll be invited to attend a supported self-management workshop where they'll have the opportunity to meet members of the team and to be educated appropriately in the process.
I'm Jill Kitto, and I'm the prostate cancer support worker for the Tru North project here at St Helens and Knowsley NHS Trust. I meet the patients following their outpatient appointment. That's after the consultant or the nurse specialist has agreed the patient is eligible for this new follow-up, and the patient also is happy to proceed. I introduce myself and my role to the patient, and I give them an overview of the whole concept of remote follow-up and supported self-management. I also tell them about a 4-hour workshop they need to attend as part of this follow-up, and I also explain the IT portal to them and the benefits this holds for them. The benefits of the IT portal is prompt PSA testing. It also has an email facility for the patients to use, and it has links called patients information links, and here the patient can access support groups, education groups and activities in the local area. The workshop is designed to give the patients education, resources and support to help them with their supported self-management. I explain to the patients that they're still under the care of the consultant and they can come into hospital if they have a problem, or we can bring them back into the hospital if we feel they've got a problem with the PSA results or with the results of their health MOT. We run the workshops twice a month and I facilitate these with a nurse specialist. The workshops have been really successful. Some men have been apprehensive about attending the workshops, but without exception, every man that has come has really enjoyed it and we've had very positive feedback.
Between May 2015 and April 2016, 132 men have been enrolled onto this new form of follow-up care.
My name's Nancy Chisholm. I'm one of the urology nurse specialists at St Helens and Knowsley Trust and the nurse lead for the Tru North project. The arrangements meant to get the PSA tests are really easy. They attend for the PSA blood test within a designated month and we advise them of when that should be. Once the men have had the PSA test taken, Jill, the support worker, and I run a remote clinic twice a month whereby we check all the PSA results for the men who we've asked to attend in that particular month. Some of the men will have already seen the blood results on the patient portal, but regardless of that, we'll go through all the PSA tests and write to all the men to let them know what the PSA level is and when to get the next test taken. This happens on a rolling programme, but if at any time you've got any concerns about a man's PSA level, then we'll recall them back to clinic and the men will receive an appointment to be seen within 2 weeks.
My name is Philip Upton. I was diagnosed with prostate cancer in 2014 after a template biopsy. And it was diagnosed as localised advanced cancer, and from there the treatment was with radiotherapy and hormone treatment for 2 years. My initial thoughts when I was offered supported self-management were great. It was a really good idea. Mainly because the PSA results I was having were stable and quite low, so it would mean me not going to hospital for checks. I also thought it was a good idea in that I could look at the results on the portal and also had access to the senior nurses and also support staff. The main advantage is that I don't have to come to hospital for the PSA checks. The PSA is on the screen. It's not just that particular test, it's also a retrospective test, in other words, tests that you've had since you started the process, and it's also in a graphical form. I'm not an expert on it, but I could follow it quite straightforwardly. In addition to that, you do get support coming from the nursing staff to clarify the situation even more if there was a problem. The workshop was particularly useful, I found, in that first of all there were other people there, similar situations. Great to be able to sort of bounce off them the problems they had and what problems I had, and learnt a little bit from it. The most useful part for me was actually being able to look at the PSAs in detail, because it gave self-assurance, and you always had that background that you could contact people anyway. Also, there was a video shown which had other men giving their particular problems and also the way they tackled it, and that was very useful to be able to empathise with that. The IT portal is very useful indeed. I'm not a computer expert, but find it easy to navigate. Tracking PSAs, health monitoring, healthy lifestyle, and also the fact that you can actually send an email via it to the support staff. The areas of the portal that I've used so far are PSA monitoring, something I'm very interested in, and the health monitoring. I've also looked at some of the healthy lifestyle aspects of it as well to try to improve my situation. The way I look at it is that I can go to a local clinic or my doctor's surgery or the hospital even to have a blood sample taken, and the following day I can actually follow the results up on the computer. So I find it particularly useful for PSA monitoring. I found it very easy to contact the team, any person in the team at the hospital. If there was any symptoms, they would tell me which direction to go, whether to come into the hospital or to just go to the GP. I've always felt confident in that aspect. I do feel supported, even though I'm not coming to the clinic, both by the nursing staff and also Jill Kittle, who has helped me enormously in actually finding my way around the portal, and also general advice on which direction to go.
In our first 12 months, we've held 16 workshops. On an average, we get 6 to 10 men attending each one. On the workshop, we cover many areas, including good planning, goal setting. We also discuss what is supported self-management, which gives the patients an overview of the whole concept. The nurse specialist gets involved with the clinical side of things, that explains future intentions for the PSA testing, and also signs and symptoms they need to be aware of to tell us about at the hospital. I ask the patients to complete a health MOT. This is for good practice for them. I also discuss healthy lifestyles and exercise, and we also make sure the patient knows how to get in touch with their clinical team. Step by step, I show the patient the IT portal. The main point for them is messaging the team, either phone or email. This gives the patients reassurance that they've got backup at the hospital and gives this a safe and happy follow-up in their pathway.
The workshops have been really successful for those men that have converted to supported self-management. All the men who've come to the workshops have said how much they've enjoyed them and how much more informed and confident they feel about supported self-management after attending. We've been surprised by how open the men have been at the workshops and how keen they've been to talk about their own experiences. The men have expressed different benefits about the workshops, just getting a greater understanding about supported self-management, practical benefits about the kind of signs and symptoms that they need to look out for. But the most common thing that men mention is the reassurance that they've got from being in a group with other men and hearing them talk about their own experiences, their own concerns, their own problems that they've had, and it almost gives them a sense that they're not on their own. The main barrier to the project has been getting men to sign up to the workshop experience. Some men are really keen on the remote follow-up aspect of supported self-management, of not having to come back to clinic to get the PSA test results. But when we mention that they need to attend a workshop with a group of other men, then it puts them off and they decline, which is a real shame. We realise that a group approach isn't something that everybody's comfortable with, but we're also aware that men on supported self-management need the right tools, the right information and the right education. To try and overcome this, we're looking at different ways that we can give the same information to these men, maybe on a one-to-one basis, so that we don't exclude this cohort of men from supported self-management, and that's something that we're keen to develop in the future.
My name is Zaf Malik. I'm a consultant clinical oncologist. I'm responsible for urological malignancy care, including prostate and bladder cancers here at Wiston and St Helens Hospital. I think prostate cancer treatment, like all cancer treatments, is evolving. The range of treatment options, the disease itself has changed. Systemic treatment wasn't something that we offered beyond hormonal treatment when I started as a consultant. Certainly that's changed forever, and alongside with treatment with chemotherapy, we're having many new agents that are being evaluated with clinical trials, and in addition to that, many other standard treatments that were recently evaluated in clinical trials now becoming established treatments of care, standards of care like abiraterone and enzalutamide treatment. Supported self-management has had the obvious impact that while patients who've had successful treatments can be removed from the clinic, and the obvious advantage of that is that it frees up time for us to deal with newly diagnosed patients or those patients with advanced disease who are currently having problems and require additional help and support, both in terms of treatment but also counselling as to where we move from here.